Well, the first question was just if you could both introduce yourself and maybe also Ella as well as an organization.
I'm Maite Karstanje. I'm a political scientist. I work for the legal department of ELA.
My name is Nadia Ferrari. I'm a journalist and I work at the communication area of ELA. ELA is an NGO from Argentina. It has 16 years, and we work especially with gender issues, especially regarding access to justice. We have a few areas of work that are access to political and participation of women, violence against women, sexual and reproductive rights, and care rights. And those are our core areas, and we tend to do different types of work regarding those areas.
So I thought to begin, maybe could you give us an overview of reproductive rights in Argentina?
So in Argentina, there are quite solid laws and public policies in place with regard to reproductive rights, but there's a gap with the effective implementation of these rights. So for example, with regard to abortion care, the Argentine criminal law since 1921 establishes 3 exceptions to the criminalization of abortions in Argentina. Danger to health, danger to life, and when a pregnancy is a result of sexual violence. However, for over almost 100 years, there's a lack of effective implementation of these rights, and there are various barriers in place to the access to these rights. And in 2012, the Argentine Supreme Court, the National Supreme Court, issued a ruling, FAL, it's called FAL, FAL, and this was issued because of to end the prosecution, the hindering and delaying of the access to legal abortions. But despite of this legal framework that's in place, and also this historical ruling, there are still barriers in place to the access to legal abortion. And the same applies as well to the access to modern contraception and to sex education. To another degree, but there's still a lack of effective access to these rights. Yes, so in Argentina, the healthcare, Argentina is a federal country, so healthcare is regulated per province. This also causes that are quite big differences as well between the provinces. So some provinces are more willing to implement the access to these rights, and other provinces are less willing, or they're more conservative. So that's a big problem, that the access is not even between the different provinces. So a lot of these conservative provinces, for example, are also provinces where more vulnerable groups are living. With rural communities or poorer people, so they face more barriers in their access to abortion.
I want to say something about this. For example, just as Maite was saying, since 2016, no, before that, 2000, I can't remember when exactly, but we have a sex education law that is actually pretty good. It's a comprehensive sex education law, which says that sex ed doesn't involve only the biological aspect of sex education, but it also goes a little bit further, and for example, included content regarding gay rights and the LGBT community. So it was a really good law, and the material that was created by that law, which was created by the Ministry of Health and the Ministry of Education of the nation, was actually pretty good. But for example, we know that a few years ago, there was a province in the north, I can't remember exactly if it was either Salta or Jujuy, that are really conservative provinces, that they rejected those materials because they used to say that those materials encourage kids to homosexuality or maybe to transsexuality, because these materials mention trans people's rights. So there is a concrete example of how some provinces created some sort of barrier regarding sex education and information for kids in this case.
What about how different opposition groups are using different forms of technology to curtail access to those things as well? Your research mentioned a bunch of examples, so I was wanting to see if we can go into different examples that the research mentioned, like Citizen Go and the different websites that you talked about, and the hotline and social media. So yeah, just interested in hearing different examples like that about the way that data is being used.
I think one example that we can give, and it is quite a common strategy of anti-choice groups, is to denounce women that are seeking abortion or in hospitals, or health professionals that are trying to guarantee this right, or they denounce them publicly online or in media. They diffuse their personal data, their information. So there are cases that that anti-choice groups, for example, spread the information of a medic when she worked, her personal data, her Facebook, whatever. They diffuse this kind of information. So there's a really personal attacks of these health professionals. And also one example that we can give is a website of an anti-choice group in Argentina as a section where you can denounce or report institutions that provide abortion and pharmacies that sell misoprostol, so the abortion medication. So there they, in the section, they send you to a Google form where you can put all the information about these services or this pharmacy that you want to report. So they are really systemizing as well the information of these services, and probably as well of people working in these services.
Not too long ago, I think that it was December last year, there was a case of a hospital in the province of Buenos Aires that hired, well, they didn't hire, a group, an anti-choice group actually offered to paint a mural on one of its walls, and it turned out to be an anti-choice mural. It was the big picture of a fetus with let's say both lives phrase, and it created a lot of anger among a lot of groups, because they considered it that, first of all, it was an anti-choice, and it was a hospital in which women tend to go to get abortions, and also they consider it disrespectful for those women. So the feminist movement started denouncing this and saying that this mural should not be existing, and eventually they cover it. But for example, this is one of the things that they tend to do, how they tend to go into public hospitals and basically show their presence, show that they are there, that they are against abortion, most of the case, in all of the cases, and in most of the cases also against contraceptive. And while they're doing that, they are sending a message to women. And they are also sending information, because they sometimes are given pamphlets, and in those pamphlets they have phone numbers to, okay, we can offer you help. And when the women get in contact, they turn out to be these anti-choice groups that they won't help her get an abortion if they want to, but they actually want to persuade them from getting them.
What about things like platforms like Citizen Go? Can you talk about how that organization, which I think is a Spanish-based organization, works in the country?
These platforms are used by various anti-choice groups to denounce, for example, gender ideology and other claims of the feminist movement. And I know that they are used to mobilize and to collect these kind of claims between different kind of anti-choice groups and networks. So they are used as a collaboration of various actors.
Citizen Go especially became an entity here in Argentina because of the abortion debate that we had in 2018. It existed before, but not as notoriety as in that moment. We especially heard information of the things they were doing in Spain, for example, with the buses, trying to impose this idea of gender ideology. But for example, in 2018, when we had the legislative debate on abortion, they were the ones who were, for example, collecting the signatures for people, from citizens, to take to the Congress as a proof of, for the senators and deputies, as a proof of, okay, all these people are against this law and you should respect their opinions. Citizen Go was one of the organizations that was actually pushing that. And I remember them going to the Congress with big binders full of signatures of people. And that's was one of the things that they used to do. I think that their show was really good, especially in putting different organizations that are anti-choice organizations together. They kind of like reunited them and were able to mobilize them in that way.
And what about the different websites that the research highlighted?
So what we could find is that there are different websites that one of the problems that these websites have is that they are really volatile. I mean, they appear and disappear constantly. They're not statics. So for example, because people, feminist organizations mostly, they tend to denounce these websites so they can be brought down, in order for not to confuse women. But these websites tend to have are really deceiving because they have kind of like some keywords that women find. For example, words such as pregnancy, unexpected, termination. They don't tend to use the word abortion, but they have all these other words that sometimes when women are searching for them, they appear. And all these websites have kind of the same strategy. That is, present a really beautiful website and friendly website with some information and kind of ambiguous, because they say, okay, you have an unexpected pregnancy, we can help you, but they never say exactly how they can help you. So maybe you think they can help you with getting an abortion and getting misoprostol pills, and it's not. They're going to help you by convincing you not to get an abortion. And they always have the same tactic, that is constantly been trying to reach to you via chat and asking you for your information, for your personal information, which means your name, your last name, your address, your phone number, your social networks. So they have a really constant contact with you, and also really direct with you. I mean, once they have your phone number, they are texting you and calling you all the time. And this is kind of the first step. And the second step is actually giving you an address so you can go. And once that you go there, we know through media reports that once that you go to this place, you actually find a place in which they try to convince you not to get an abortion, for example, and they do this with really ugly methods, just as showing videos, showing pictures, giving a lot of misinformation. and lying a lot of the times. And also they have this method of scaring women, talking about consequences such as infertility and and also talking about death. That's something I mentioned a lot. And what they do is try to offer this idea of not only not getting an abortion, but also kind of giving birth as the thing that a woman has to do. So with this idea, they also try to keep you away from birth control, because obviously that is going against what a woman has to do. And they have not only they have these ugly methods, but once if the women leaves, they are known to keep on calling you and telling you, okay, we know where you live. They have a really um, uh, confrontative method to approach these women and basically scare them. That is the main thing, to scare those women.
And what about the hotline that was proposed?
One of the things we didn't mention is that we in Argentina have a hotline that is official of the government, that is of sexual and reproductive rights. It's a hotline that where you can get information, true information. I mean, there is a group of women, mostly of women and men, who give information regarding birth control, regarding abortion, regarding sexual and reproductive rights. That is actually a really good hotline. And where it's a hotline that where you can also, for example, if a woman goes to a hospital with a health issue and she needs to get an abortion, and in the hospital they say that they won't do it, these women can call to this hotline and say, okay, in this hospital they didn't respect my rights, so I want to file a report. So what these anti-choice groups tried to do was kind of a hotline that was opposite to this one. A hotline for women to call, and in which they wouldn't be getting information, for example, okay, if you need to get an abortion, you can, under these circumstances. They will be saying that abortion isn't legal because that's what they are always saying. That's their main hypothesis, so to speak. And the idea was to have this hotline that was made by a network of anti-choice groups, and they asked for a subvention for money from the state, and they signed an agreement to actually give them this money. When they did the presentation for this hotline, there were a lot of organizations that said that this hotline was against the law, basically because it wouldn't be respecting the access to abortion and the access to good information. So, and also there was a lot of talk regarding the use of state money, basically. So it didn't take long until this hotline was taking away this money from the state. And these organizations said that anyhow they were going to continue with this hotline. We know that that number doesn't exist anymore, but we know that some of these organizations had, for example, a phone number, a cell phone number that they started sharing via their social networks, so women could get this information, so to speak, anti-choice information, and in that way continue a little bit with this original idea of the hotline. So we could say that this hotline exists today, but not with the reach they wanted originally, because it doesn't have the help from the state, and it's not that number that that you can call that actually was free. If you call it was free for the women, now it's a number that if you call, they charge you. So that's basically what happened with this hotline.
And then what about social media? How examples of sort of what you've seen on social media?
Yes, so there are various investigations in Argentina about the use of social media by anti-rights actors. And what we see there is, for example, with Twitter, their posts on Twitter are more popular or receive more reactions or and comments and likes or whatever than the posts of the feminist organizations. So they've got a big presence on social media. And they use their there are different actors, so all the different actors use their social media in different ways. So, for example, there are social media of anti-choice groups, anti-choice NGOs, organizations. There are also social media of conservative actors that use their social media more in a way to, they try to in a way of posting informative posts, so more academically or more like related to science. And what they do there a lot is as well, for example, diffuse false information on the supposed post-abortion syndrome that is not acknowledged by the World Health Organization. All these organizations have a lot of posts on the supposed dangers of abortion, scaring women. All these kind of they use a lot of messages of death and fear and dangers and all these kind of things to promote the idea that abortion is dangerous and causes deaths and makes women miserable. And with this false information, that with like false research or with like academic research, they try to argue why it's dangerous and why it causes death. So there are different tactics that they use, but they do it quite successfully. That's the thing. They've got a large presence on social media, and this presence has grown a lot since the congressional debate on abortion in 2018. Since that moment, during the debate and after the debate, these groups surged and grew stronger and grew more articulated, and they work together. So that's quite notable since the debate in 2018.
We also know that these organizations, they have a big presence on social media, especially Twitter. Twitter is kind of a big deal here in Argentina regarding politics. And they had a big presence on Twitter, especially in the debate. And there were a lot of accounts that were created when the debate was happening. And just as Maite said, they tend to reproduce a lot of messages regarding death, relating abortion with death. But also they started doing something extremely interesting, so to speak, that is saying that they are the real defenders of women and saying that they are feminists. So they call themselves anti-abortion feminists. And that they are doing everything just to respect women and in order to help women and to protect their rights. So that's something that is a message that they kind of stole from us, from the pro-choice movement and the feminist movement, and they have a lot of presence because of this. And also one of the other things that they do have is that they have a little, but they do have some people that are kind of their their pillars, the main person that is talking, and their speakers, and they have a lot of presence. Names such as Agustín Laje, who is, I think that is a journalist, a writer, and he has a crusade against feminism and gender ideology. Another woman called Amalia Granata, who was a model, and now is she's a congresswoman, unfortunately, in a province. And another journalist called Mariano Obarrio. They have these speakers that are really good, and they have a lot of followers, and their ideas are expanded massively. So that's what they kind of use, and we have to admit that they've been really good at exploiting those ideas.
I think the messages of these anti-rights groups across the region, but also worldwide, are very articulated. They're very collaborated. So as what you said as well, they have the same messages, they have the same strategies regionally. So we are convinced that there are foreign groups involved as well in creating these messages and helping with these messages and helping with different strategies as well, the communicational strategies that they have. Also with, for example, the websites that they have and that have been created very deceivingly, but also very attractive. That must be that they must have created them with funds abroad, and also with their messages on social media. Those messages are also reflected in other parts of the region. They use the same arguments. They also retweet things from other organizations in Latin America. A lot of course, all Spanish messages, so that's why it's all a lot of retweets or a lot of messages from other actors in Latin America. So what you see is that they are very much connected, the anti-rights groups in the region, and I would also say worldwide as well, because there are a lot of conferences. But specifically about the funding, we don't have that information, so I couldn't say if they receive funds for the social media exactly, but we would conclude from the different messages and the different strategies they use, and they all have reflected regionally that they work together and that they have the same message and they are one front against the feminist movements. We would say that there's a high level of collaboration between these organizations.
I think that these organizations are always paying attention to new technologies and trying to find a way of how to use them. So I'm pretty sure that if something new comes up, such as either a new artifact, so to speak, or a new social network, they will try to find a way to exploit them. For example, and it's not about sexual and reproductive rights, but I know that we have the traditional networks, social networks like Facebook, Twitter, Instagram, and we have kind of like a new one with TikTok, for example. And I know that doing some research, there is a lot of group and people, because sometimes they act individually, that are sending information regarding gender-based violence, and kind of saying, oh, all these feminists that are crazy and gender-based violence doesn't exist, is an example of how these ideas, these conservative anti-choice ideas, are moving through the new social networks that are appearing every day. So these groups are really good getting to recognize the new technologies, use them, and exploit them. So, and I think that in related to that, one of the mistakes that the feminist movements has, or the pro-choice movement has here in Argentina, is that we are kind of always one step back in that area. They tend to be a little bit faster when it comes to taking advantages of these new technologies. I believe that they are going to keep on doing this, especially because it's kind of a silent way to reproduce their messages, because it's both massive but at the same time difficult to find. One of the things is that you need to have a really good eye when you're on searching on Google or on social networks, to actually realize that this is an anti-choice organization. And also they tend to always be linked with each other. So you go to one link and that takes you to another, and it takes you to another, and it takes you to another. So it's a whole network created by them that it's deceiving and also difficult to find the root. And also I think that is one of the main problems that we have with these organizations. I remember during the debate that they were all the time throwing dirt at us, and the pro-choice organizations and movements regarding our foundings and where did we used to get our money. And if you go to most of these organizations' websites, if not all of these organizations' websites, you are going to see all the list of these of our foundings. When if you go to the anti-choice movement, they are not. So it's extremely difficult to actually trace them, and it's something that is difficult. And so it's difficult to attack them, basically. So they're going to continue to use the new technologies, definitely, and we know that their method is a one-on-one attack. They go one woman by one, and if they can persuade one woman, they already consider it a huge success.
Yeah, I just want to add as well that, as we said before, these movements, the anti-choice movement, became more visible in Argentina during and after the debate in 2018. So before that, of course, there were anti-choice movements and actors in Argentina, but now they've become more stronger, more articulated, more visible, also online. And so in one way, they're just getting started as well with their use of social media and the websites, and they surely will develop themselves even more online, and also copy a lot of the strategies that are already existing in other countries that have an anti-choice movement that has been present for longer, for example, in Mexico or in Peru. So they are copying those strategies, and it's expected that they will strengthen their presence further online on social media and also on their websites.
So my last question for you was, can you just talk about what's coming up in reproductive rights in Argentina? It's obviously an active time at the moment, and so if you could give just a kind of overview of what's coming up.
Yeah, well, we're expecting that there will be another debate on the legalization of abortion in the Congress in Argentina. In the beginning of March, the Argentine president, Alberto Fernandez, was about to send a project to the Congress to legalize abortion, and was expected to have broad support. But then everything happened with the coronavirus, and they had to prioritize that. So at this moment, we don't know what will happen and when it will happen. It depends on how the pandemic will evolve. But our expectations are that the project will be presented at some moment when everything turns, or when everything turns back to normal, or when the crisis is solved. So also our expectations also that the anti-choice movements will become very active again at that moment. They're still active, they're always active, but this, they will be organize themselves strongly against this legal debate, as they already did in the beginning of the year when it was already expected that Fernandez would send the project in March. They were very active in January, February against lobbying against this project, and they are for sure going to do this as well when the project will be presented, offline as well as online.
Yes, everything is kind of on hold right now. One of the things that we are working really hard, and we're also doing a lot of campaigns via social network, is to remember women that even in this situation of pandemic and lockdown, they still have rights. So their rights should be respected if they need an abortion. We think that it's actually extremely important right now because we expect a baby boom. That is the reality. And so we actually think that it's important to remember that they have access to birth control and abortion even during the lockdown. And another thing that is actually kind of funny, kind of sad and pathetic on the side of the anti-choice movement is that they are finding on the social networks, we're actually seeing that they're finding ways to link the virus with the feminist movement, and kind of they're saying that, okay, this virus happened because of the feminists and all the people that are pro-abortion, and they're doing a lot of memes and images and videos that get viralized really fast, kind of attacking the feminist movement, linking it with the virus. So it's kind of sad, and it's also sad the fact that it gets a lot of presence and it viralizes really fast. But that is just an example of how they're working, even in this scenario of pandemic, and when the pro-choice is trying to remember rights and their information exactly as it is, they are giving misinformation, doing something extremely insane as this. So we're expecting what's going to happen with the law, with the amendment. We mentioned that someone in the year in 2020 this amendment will be presented, and it has a lot of support because the president is going to present this amendment. So we think that it's going to do well, but we just need to wait and see.